Hi, everybody. This is Homeopathic Cancer Treatment Explained with cases with the illustrious, and I do mean illustrious, Manfred Mueller. We are very, very thrilled to have him joining us here tonight. I am Robin Pollock-Daniel. I'm your moderator for tonight. I'm going to give you a little bit of an introduction on Manfred Mueller, even though I'm sure it's not necessary for most of you. He is a German-born U.S. homeopath who pioneered reverse chronological tautopathy, quote-unquote clearing remedies, a systematic approach to removing the secondary effects of past suppressions, such as from antibiotics, steroids, NSAIDs, vaccines, etc., by a brief pre-treatment with the same or similar substance in potentized form. In his practice, Manfred uses multiple strategies that integrate current scientific insight into homeopathic methodology without sacrificing the classical principles. He has developed a comprehensive approach to homeopathic treatment that not only removes obstacles to cure, but also addresses the predisposition to cancer, one of the most prominent disorders of our time. To that effect, he has just written a book called Homeopathic Cancer Drugs, Oncology, Materia, Medica, which is a groundbreaking reference book for practitioners with over 600 remedies, and it's the most thorough reference work on homeopathic cancer drugs to date. In 1989, he founded the Homeopathic College, which specializes in distance learning modules which cover a variety of advanced homeopathic concepts. These are designed to help the practitioner broaden his or her clinical skills and increase success rates. Since 1995, Manfred has both been an integrative medicine consultant for the program on integrative medicine for the University of North Carolina School of Medicine, and has taught an annual introduction to homeopathy class for their course, Principles and Practice of Alternative and Complementary Medicine. He was president of NASH, the North American Society of Homeopaths, from 2005 to 2015. That's a very long time, and was a past board member of the Homeopathic Action Alliance and former board member of what is now called ACHINA. In today's webinar, Manfred Mueller will demonstrate with 3 cases his unique approach to homeopathic cancer treatment. You've heard much more than you need to from me. Please, Manfred, take it away.
Thank you, Robin, and thank you, WholeHealthNow, for hosting me tonight. And hello, everyone. I know that you're all waiting for the cancer cases, and also, of course, how to take the cancer case. But before we go into these, I have some nuggets for you from the newly published Oncology, Materia, Medica. I won't bore you with a 15 or so sub-chapter, the schema, which every chapter is laid out. It begins, however, with an important subject, and that's identification of the substance. And of course, usually our remedies are made from substances, not all of them, however. It's extremely important because, believe it or not, in our 600 or so cancer drugs, there's not always clear consensus as to what we're dealing with. So I have put in extensive research into the identity of many of our drugs, and also into the identity I found out, and I didn't plan on finding that out, of drugs that were previously simply unknown. In other words, nobody knew, nobody said anywhere in any source what this really was. So I had to do it myself. I did end up determining the identity of many of these that were previously unknown. By the way, for those who are upset about the term drugs, drug is the official legal designation of homeopathic remedies in the United States. Not my invention, but that is what they call them. We have drugs. And also, I feel like, if you're going to treat cancer and you're up against all these chemotherapy drugs, I think we need a little self-confidence. And I think that's why we should call them drugs. I think we should call all our remedies either medicines or drugs, because that's what they are. Now, I will give you a few examples of drugs whose identity I have personally established, and they are to be found in the Oncology, Materia, Medica. This is one of the main reasons why every homeopath ought to own one of these books, whether or not you treat cancer. There are many, believe me, many, whose identity was not established clearly. Okay, the first one is a strange drug called Bomhenia. Have you ever heard of it? Bomhenia. It is one of the remedies by Grimmer. Dr. Grimmer described it as an ornamental tree, and after polarity tests showed vibrations for cancer. He used it for a case of uterine cancer with hemorrhage. I wrote about my rather lengthy search for the identity of this drug in an article called Bohemian Villages and Cow's Paws. My search for Bohemia, published in the American Journal of Homeopathic Medicine. You can see that here. It's a wonderful, beautiful tree, Bohemia forficata. Did you know what Ogopora is? Ogopora is listed by Gilchrist and Blackwood for cancerous affection. In other words, a homeopathic medicine for serous of the uterus. Did you know what it is? Well, you can find out in the Cancer Materia Medica. And you see the name of it is right up here on the screen. Also, have you ever thought about what the tarantulas are? The Spanish tarantula and its relative, the Cuban tarantula. Did you know they were relatives? Well, they are. But what is the true identity of those two drugs? The Oncology Materia Medica answers that question. And I give you a hint. Are they really tarantulas? No, they're probably not. So they're actually two spiders. The next one is called Paranichia. This drug is mentioned by Julian for cancerous affections, especially for cancer of the rectum and uterus. But what is it? It's a beautiful ground cover, as you can see here in the picture. Finally, what is the true identity of the drug Verrugosa, or the full name Verrugosa acrocordon chocoe fel? In my opinion, it should be used as a cancer drug because it is used for treatment for deep, almost incurable, otherwise, funnel-shaped ulcers that expose the bone. And you can learn more about that wonderful, wonderful medicine in Oncology Materia Medica. There are many more. You can read all about them. This work is really to be read. It's full of valuable information. Other than the identity, of course, there are many other things that you need to know. So, for example, what are the pathogenetic trials, as we call them, the provings, that gave us the information for how to use this particular drug? Well, to my surprise, there's enormous differences in, first of all, the methodology of the provings, but also in the true numbers of provings and in the validity of the provings. When you read that, it's all in there. Then, of course, posology, fascinating topic. How to use. Many of our medicines that we use for cancer are used according to the people who, homeopaths who use them. They're used in a tincture form. Did you know that? That doesn't mean you can't use them in other potency, but they were used, and all the cases I could find for many of those medicines were used in the tincture form. So anyway, this gets me to the homeopathic treatment. In the Oncology Materia Medica, there is mostly an emphasis on clinical and pathological treatment, but I took all of the case documentation from any kind of treatment, any method of treatment that had been used historically in homeopathy, and for all kinds of locations and all types of cancers that they were aware of at the time when the articles were written. As Hahnemann said in his Organon, cancer is a one-sided or a lopsided disorder. In the older translations of the Organon, you might find the term defective disorder. What does that mean? It means a disorder without symptoms, or with only very few symptoms, so few that you could really not identify a remedy on the basis of symptoms. Hahnemann was well aware of that, and he said cancer is one of such a disorder. So what does that mean? It means we have to use other methods of treating it. Ordinary rules of homeopathic treatments do not apply with cancer. So one might ask, why not use constitutional treatment? In other words, find a remedy for the patient. Well, interestingly, the king of constitutional treatment, James Tyler Kent, wrote in his lesser writings that he did not believe cancer could be cured, period. because he noticed that constitutional treatment did not get you anywhere. In other words, he did not see the typical healing evolution that he described in other cases and disorders when you use the constitutional method. For example, he would look for Herring's law, evidence that the symptoms are moving. Well, if you don't have any symptoms, how can the symptoms be moving from the center to the periphery? So these are issues involving cancer treatment. I'm saying this as introductory, can't possibly cover all the issues of cancer treatment here. This is just a teaser. So Ken concluded he could not cure cancer with homeopathic treatment, period. In other words, whatever you did, it wasn't a cure. I'm not sure I'll buy that, but so be it. Constitutional is a valid treatment in homeopathic cancer treatment. This is why I included a section, one of those subchapters are called Constitution. We do need the constitution of the patient. And if there is clear indications for a remedy, there's no reason why we shouldn't use that remedy so long as that remedy can cover the pathology. There's some interesting studies that were done, by the way. Some of them were done by the Samuel Institute, and they involved, one of them involved the remedy or the drug Sabal Cerilata, and they tried it for breast cancer and a few other cancers. Well, it worked for prostate cancer, and that's important. Another study found, tested conium, Sabal again, and several others, and found no, conium did not work for prostate cancer. So what does that mean? Well, one study means nothing, but several studies, if it's a repeated finding, it could mean that, yes, there are some clear-cut pathological affinities of certain drugs. There's no doubt that chelidonium has an affinity on the liver and with the liver. And why should it not be true in cancer treatment? Chelidonium is a prime remedy for liver cancer. There are many others, but yes, we do have indications that are pathological. In other words, we can use the pathology to lead us to a remedy. And all of this you can find in the Oncology Materia Medica. There are numerous remedies specifically, and the schema is organized by pathology. In fact, it's one of the first after identity comes pathology. Of course, we also include the symptomatology because whatever symptoms they are, they do matter. And of course, I'm not saying that the Constitution does not matter in general. Yes, it does matter. All of this matters. There are more than one way to skin a cat, and there are more than one way to treat cancer. I think that the remedies selected by pathology only are weak. However, remedies that are selected by multiple of these factors are strong. So, why can we not use the typical normal approach? Why not just find the constitutional remedy? Well, because we live in a different time than Hahnemann lived, in a different time than Kant lived. And I don't know how much time I have in terms of going into this, but I recommend that you listen to my tutorials. They're available on our website of the Homeopathic College. We go in depth into the various issues. Definitely homeopathic treatment, regardless of what method you use, is better than the alternative in cancer. Because you probably know, conventional treatment of cancer can be very harmful. It can also be very ineffective. Often if it doesn't work the first time around, it never works again. Basically, it's a suppressive method, and it is definitely preferred to use the gentle, safe homeopathic treatments in favor of the medieval, torturous, dangerous, and sometimes deadly conventional drug therapy, even though sometimes surgery is necessary, and radiation is just as deadly as drugs. So I'm asking, would that not justify to use homeopathy with its 200-year-long history? Now, what do we need? What do we mean by Constitution? Well, the Constitution is not mentioned by Hahnemann. He never defined it. What Hahnemann did mention, however, we should select the remedies with consideration of the temperament of the person and other factors. That's what's in the Organon. I recommend you investigate what constitutional treatment means in other authors, especially from the 19th century, because they are the ones who started this constitutional business. So find out what Hahnemann felt, what Hahnemann thought was important, and also what Kent thought was important in other people. More on this, like I said, in my tutorials. By the way, Hahnemann never treated the patient. He always, in the Organon, says the disorder or the disease. He treated diseases. He also laid down methods on how to do that. For example, Hahnemann recognized that there are different sensitivities among our patients, that some patients need special treatment. And he explained very carefully in aphorism 270 that we can use further dilutions, or that we can use olfactory doses. All of the above is incorporated in a method that's now called the Mueller method, because I put all this together in one comprehensive approach. And that's exactly what we use in cancer treatment. The techniques that Hahnemann recommended are applied, not only the techniques, but also the underlying principles, the theory, are applied to the 21st century situation. I'm a century behind. Yes, they are applied to our today's world, today's clinical experience. When we see patients who are come on and they're currently on 15 different medications, do you think these medications do something to the symptoms of the real symptom picture of the disorder? Of course they do. So we need to deal with that, as you have seen in the heard in the introduction that Robin read earlier. There is a method to basically reduce things to the real disorder and also to the real constitution, to the diaphysis that brought about originally the cancer pathology. But the fact is there's many other things that bring about cancer pathology. So what else could be needed for cancer treatment? Of course, SORA is always there. We've seen that in many infectious diseases, but we also see it in many, many, many chronic diseases. Whenever you do the research, and you'll see this in the cancer Materia Medica, almost every remedy used for cancer is always a psychotic remedy. It's always a syphilitic remedy. And many of them are also tuberculosis remedies. And they're indicated especially for the so-called scrofulous cases, to use the 19th century term. Scrofulous means a tendency to be run down and develop having chronic swollen lymph nodes. That's what scrofulous means. Is that what we see in every patient today? No, we do not. That's why the information we have or had in the past is not sufficient to cover today's cases. Yes, you can cover some, but many you cannot with that information. You need more information. So what do we see in today's patients? Well, in industrialized countries like the US or Europe, and I hope someone from Europe is here, but it's a little late over there, isn't it, right now? But anyway, we have, of course, a lot of other issues that lead to cancer. We can't just say, oh, it's just a psoriatic disease, it's just a syphilitic disease. No, it's not. It's all of the above, yes, but that may be 5 generations ago. What are we affected by today? In our current cancer patient, we see a history of suppressive drugs like prednisone, cortisone, antihistamines, painkillers, and a host of other medications. Very effective medications to suppress our patients. they don't stand a chance. Homeopathy is not going to undo this suppression unless you aim directly at it. Of course, that's what we do in the Mueller method. We also see dozens of vaccines. Sometimes we have some ex-military types who have 10, 20 different vaccinations, some of them recently. In virtually every cancer patient, we see multiple X-rays and CT scans. Why? Of course, because we have the best of medical care, best of medical diagnosis. We use it, right? But what does it do to you? Then we see, of course, histories of chemotherapy and antibiotics. Those can change, sometimes permanently, the internal balance, the internal, or as Ken would have used the term, economy of the body. Why? Because the antibiotics eliminate a lot of natural, benign, and beneficial microbes that we have naturally in our gut, for example. Take the toxic fluoroquinolone drugs, very effective, but guess what? Very, very often they have been associated with a decline in the patient for various reasons. We also see patients who have received opioids, penicillin. We see patients who have been on estrogens or who've been exposed to various other endocrine disruptors. Women's cosmetic products, for example. We see xenoestrogens from soy products. Of course, you know estrogen plays a role in some cancers. So does progesterone in some breast cancers, for example. We see pesticide exposures in our food. Wouldn't it be wonderful to have in our cancer materia statements like estrogen-dependent cancers? Try to find that in our 19th century. Or Herceptin, I mean, there's all kinds of terms in oncology nowadays. You can't find it, okay? But it should be there. And it will be there in the future if we continue this research. Then the toxic exposures. Imagine how many people have toxic exposure at their work that precipitate change in their DNA that ultimately turns into cancer, proliferation of a tumor. We see recreational drugs, people who've been taking marijuana or smoking marijuana for years. We see people on cocaine and LSD. Then, of course, we have the numerous still, and they're in our Materia Medica from the 19th century, alcoholics, people who have been taking alcohol for years, people who use tobacco regularly. Of course, tobacco's gotten a bad rap. Actually, tobacco is a cancer drug, by the way. That means we can use it in homeopathic potency to improve the symptoms and also the pathology of cancer. There's studies that prove that. In addition, we see occupational exposure from fiberglass, building material, asbestos, metal solvents, PVC, gasoline, and diesel fumes, numerous others. So what are we going to do with all of this? Well, we incorporate it in our treatment, and that's what we'll learn today. So the important factors in the evolution of cancer need to be assessed, first of all, in the history, when you take the cancer case, in the history of the patient. I think we want to go to that, perhaps. I do want to say one more thing. Yes, Hahnemann and many 19th century homeopathy dealt with natural disorders only. That means infections. That's what homeopathy was all about then. Try to cure acute and chronic infections and chronic disorders resulting from those infections, not today. Hahnemann even said in Aphorism 74, also source of chronic diseases are medical drugs, iatrogenic influences. And he almost despaired when he considered the effect of those. He said basically they're incurable. Well, they're not quite incurable, thankfully, because we have applied many of Hahnemann's principles, and that tautopathy is one of those principles applied to drugs. Also to the effects of aluminum. You probably see In the cancer material under alumina, you'll see Marker Tyler's case. Actually, it may not be in there because Marker Tyler used aluminum to counter the effects of exposure to aluminum heaters. Grimmer saw the connection. He identified coal tar drugs as major factors in cancer and in the etiology of cancer. Etiology means the cause of cancer. And of course, bad medical treatment in general, including surgery, chemotherapy, and radiation. And he developed specific remedies, and they're all listed in the Materia Medica to counter those. So I'm going to fast forward to how to take the case. Of course, we want to write down the symptomatology that's related to the tumor. In other words, wherever the tumor is, what other concomitant signs there are in that area, and also the symptoms. Pain is important, the nature of the pain, etc. The next step is the family history. It's it's the history, the health history. It's the next, so family history is up here, but that's really the next step is, I usually take the history right after symptomatology. Then comes the family history to see what's inherited after finding out what's acquired during the lifetime. And the family history includes what chronic diseases have run in your family, and tell me who had it and how many people had it and so forth. Sometimes you find diabetes and you find one case of cancer, but you also find alcoholism, you find drug abuse, and you find, let's say, suicide in the same family. If you have that, you've got a cancer diathesis based on our homeopathic tradition. If you want to learn more about it, I wrote an article called The Cancer Diathesis, and it was published in the American Homeopath. You can find it on our website. Then comes causation. Outside of that, outside of the health history and so forth, there are causations, like I said, they come from your job, they come from your home. Indoor pollution is a big thing lately. So we have all this knowledge, and then what do you do with it? How do you select the cancer drug you need? We use repertorization of the pathology. Now, the repertory for the full cancer Materia Medica is not available yet. I'm working on that still. It's an enormous amount of work. Yes, we have some, you could say, rudimentary information from the complete repertory. You can also do some searches in reference works. That's great, but that's not enough. It's poor. It's very, very limited. So yes, we can. We're in the process. I have a professional military type who knows how to deal with computers. He's analyzing. He's also an MD. He's analyzing currently the whole cancer Materia Medica, and in fact, he suggested doing that. And of course, I took him up on that. And this is going to come out hopefully in the next few years. The third volume, I'm going to give a little preview of that later on, is also a kind of therapeutic index that will help. I also want to mention here the peculiar and interesting symptoms, if there are any, of course. Hahnemann said that is the key to a case. Then the constitutional analysis, that's self-evident when you read the parts on constitution. Same thing with the etiological analysis. Under Clark, you would find it under cause. Of course, there are far more causes listed for our drugs in other Materia Medicas, and I incorporated all of the above in the cancer Materia Medica. Then the clinical analysis. What is that? Well, that means that there are some medicines that have a certain pathology, so that's partly important, but also clinical analysis means at what stage of cancer is the patient. There are many other issues to consider. What other concomitant diseases are there present that could interfere with the treatment or could be in need of addressing? And then finally, the rating of the remedies. I'm giving you only a hint here. The rating, every remedy should get a rating, like I said earlier. If you only have one single mention, no proving, no medicine, no symptomatology, you don't even have a cause for that brings about the state that this remedy can address. Well, you have a very poor remedy here, right? So you're trying to find, also I have incorporated efficacy trial. If a remedy has efficacy trials, that makes it rated higher. You can rate it on the basis of how much evidence do you have in support of using that remedy for this case. That's basically what this is about. I move on. The potency and the dose. Most homeopaths are never taught, and that's why I mentioned earlier that there is different sensitivities. That not everybody needs the same dose. That you, dependent on the dose, you can do things like further dilutions. You can go to olfactory doses. Then the repetition of the dose. Do you give it every day? Do you give it once a week? Do you give it once a month? What do you do? And then the adjustments that you can make. I'll move on. The treatment itself is actually the giving of the remedies. So in our case, it's often in America, it's often the patient treating themselves, right? You don't actually know what they took. They'll tell you in a follow-up. That's why I have, at least in the beginning, I have like a follow-up consultation every 10 days. And then I gradually go to a month, maybe 3 weeks at first, and then to a month, and maybe 2 months once they have improved. But during that initial phase, you definitely need a constant follow-up. Make sure they're doing what you ask them to do, and you constantly have to correct everything right away. So then what do we do with the remedies? Well, we found often that the diathesis needs to be, the cancer diathesis needs to be addressed with, say, the remedy carcinosin or serinum, one of the constitutional cancer remedies. At the same time, you want to give a tumor remedy. So you alternate the two. I often alternate them on the same day. So we have one in the morning and one at night, and the next morning again, next night, and give all of these in the so-called Q potencies, by the way. Those are similar to the LM potencies. You can learn more about that in the tutorials. Tumor-specific remedies, tinctures, extracts, infusions are used in our Materia Medica. You didn't know that? Well, you'll find out in the cancer Materia Medica when you look at the dose given. Well, some of them are given in the arborivital dose. Cooper used to do that. He said, he was glad that he never got involved in the, what he called the delusion of potency. He thought that was a delusion. Yet he was one of our most successful cancer doctors. And they're ignored for some reason in the complete repertoire, by the way. But I'm so glad that I read this book, because I recognize that there's more than one way. And sometimes it is actually better in some people to give a low potency or no potency level. And it does a wonderful job, and often much better than the potentize. It really depends on the sensitivity of the patient and many other things. Some people use organ support remedies in addition. That includes also remedies like, let's say, thyroid. Remedies made from the organ, so that would be sarcodes. I do want to mention detoxification. Almost always needed when people want to do homeopathic treatment, either after or while they are doing conventional treatment. So you need to detoxify the conventional treatment. Like I said, I can't go into all the details here. This is very, very rudimentary only. There's auxiliary and supportive remedies. There are nutritional supplements, additional help from other integrative treatments such as acupuncture. If someone has cancer, you need to give them whatever's there. Sometimes ozone therapy. By the way, homeopaths very, very often endorsed ozone therapy in addition to homeopathic treatment, although Clark says it only worked for a period of time. And then, of course, auxiliary measures. Now we finally get to the cases. How do you take cancer cases? I'm going to leave that section out. I don't really want to talk anymore about this. We're going to start with the case of brain tumor. While we're discussing the case, I will bring in some of those issues. So the first case is a diffuse intrinsic pontine glioma, which is a cancer of the brainstem in a 6-year-old boy. By the way, the description of this comes from 3 different remedies used for this case in the Cancer Materia Medica case documentation section. 6-year-old boy recently was diagnosed with DIPG, and he was to receive 6 to 12 weeks of treatment with standard radiation. However, after the second week, he became unconscious, unresponsive, and bedridden. He no longer could talk to his parents. After the parents realized what was happening, they thought he was going to die. Parents demanded discontinuation of the radiation treatment and expressed their desire to take their son home. However, the doctor told them he would die if the treatment were discontinued at this point. So they were going to continue the radiation treatment regardless. The doctors even discussed funeral arrangements with the parents after they said, we're going to take him home. They said, please stay here. While unresponsive, the boy, let's call him Tom, was picking on his bedsheet, a prominent and reliable keynote indication for Hellebores, which promptly brought back full consciousness, and he was able to respond with gestures and sound to his parents. Encouraged by the effect of the homeopathic treatment, parents took their son home over the protest of the attending physician after repeated doses of Hellebores in alternation with X-ray. Over a few weeks, he started talking and walking again. See under Hellebores in the Cancer Materia Medica. However, after this spectacular recovery, he was still foggy, drowsy, weak, and dizzy. And on trying to go up or down stairs or walk on an incline, he had a funny feeling, well, an unusual pronounced feeling, as if he were falling or a fear of falling. So he would often not walk. Gelsemium removed these symptoms and restored his overall energy level and strength back to normal. He seemed now no longer foggy mentally. Within 3 weeks, the parents reported he appeared almost back to normal. After several weeks of further homeopathic treatment at home, parents stopped using their cell phones at the recommendation of their homeopath. And the effects of the cell phone exposure were cleared with repeated doses of mobile phone in a 30C potency. We do up to 9 doses and then leave it because there's continued improvement usually after that method. The improvement was dramatic. Immediate increased mental clarity, no longer foggy. His concentration was noted. A week later, the child started talking normally again, completely normal. Before he was better, but he wasn't fully normal. He acted much less clumsy, and another week later, his chocolate craving was reduced. He seemed almost back to normal. The physical exam 3 weeks after this remedy found reduced brain swelling and a slight reduction in tumor size. Over the next 6 weeks, the child showed continued improvements until all symptoms had disappeared. The parents said they spent the best summer with their child ever. Now comes the bad part. However, if you know pontine, diffuse pontine glioma, you know that's a death sentence usually. There have been some cures, but this one was not. However, the pressures of life soon put an end to the euphoria. Since the parents had to work, they were also in the middle of a divorce. And that doesn't stop just because the child is having cancer, apparently. The child's grandmother decided to stay with the boy, insisting on carrying 2 cell phones on her belt at all times. They were turned on, of course. She had to receive calls, she insisted. Even though she was warned about their potential adverse effects on his sensitive system, she refused to turn off the device. After only 1 day of exposure, parents reported his condition had again begun to deteriorate. Despite the parents' repeated requests to stop carrying the phones, the grandmother refused. The child became increasingly lethargic and disinterested in playing. He finally stopped talking. At this point, the mother asked the grandmother, begged her to leave, but it was too late. Tom died peacefully 3 weeks later. The grandmother, I should say, has since herself succumbed to lymphoma, possibly from her own cell phones. I want to say one thing about this. First of all, it illustrates the importance of exposures, environmental or whatever you want to call that. It is important and we cannot ignore it any further. I know that there have been studies, and if you want to continue to ignore the cumulative research, which has been hundreds of studies on the dangers of cell phones, including when the cell phone is turned on within 15 feet of your body, also from Wi-Fi devices, which use the same microwave technology. Also, the cell phone towers, or masts, as they call them in Europe, especially in children. You will sooner or later have to deal with the consequences. Keep in mind, childhood cancer has increased by 38% in the United States over the last 10 years alone. That's all I'm going to say. Case 2, breast cancer. By the way, we do a lot of educating in our practice, constantly telling people about the health effects of this and that and the other, and you see a lot of this is on our website. Okay, breast cancer. This was diagnosed as ductal carcinoma in situ. The next case is actually referred to on the net by the patient herself. She wrote an article called "How I Used Astrology to Choose Breast Cancer Treatment." You can find it on the web, part 1 and part 2. The patient had a large tumor very close to the nipple. She never, however, did radiation and chemotherapy, only homeopathic treatment. And however, she did agree to surgery done by a cosmetic surgeon, not an oncology surgeon. That's important. And I should say something about this woman. She was very smart. First of all, she had used to be a hospital administrator. That means she had first-hand knowledge what goes on in these places. And she had already decided that by the time she decided on homeopathic treatment. She knew. I had told her, actually, that it would be, since she has such a big tumor, it would probably be needed. In her case, we'll have to see. I said, probably not for another year. We can do treatment for a year, and you know, there are many beneficial things from the treatment, but I did not feel we had the time to completely cure this cancer, because what happens with these cancers, often they burst open and they endanger the life of the patient, especially if they're close to an artery or main blood vessel or something like that. So I have some experience with this from other cases. So the big issue in her case was not the tumor. It did not lead to a remedy, at least not to the one we chose in the beginning. In fact, she wasn't even on a tumor remedy. She was on a constitutional, actually on 2 constitutional remedies. It was very clear that she also was in a very suppressed state, so that matters. The key issue was suppression of the immunity. Her body was operating under many different stressors. One was the deep-seated emotional traumas that she had been exposed to going back to childhood that was still affecting her. In other words, there was deep grief that she was still affected by. When that is there, you need to deal with that. That's important. Then she had a mouthful of mercury amalgam dental fillings. Why does that matter? Well, because it's a poison. And guess why? Because you absorb 0.33 microgram of mercury from every single dental fillings per day. And that is, if you have 10 fillings, that's more than 300 times OSHA, maximum OSHA allowable limit in work environments. You get that 7 days a week, 24 hours a day from your mouth. You swallow it, you inhale it, you get vapors that are emitted from those fillings. Then she had various strange treatments in the past, including a zapper. She felt that was adversely affecting her. Also, she had a root canal, according to, I think it's Dr. Weston Price research. He was, root canals can wreak havoc with your immune system. They can cause autoimmune type reactions. In other words, you can build antibodies against your own DNA. There are many different negatives in this case. In fact, I cannot tell you all of them here. I'm just giving the most important one. There were several infections. There was the stress from her professional status. After the initial clearing treatment, which involves what we call the pharmacodes, she was for several months on natrium muriaticum and lycopodium in alternating doses in Q potencies. Within 2 or 3 months, she opened up. she started revealing very relevant things about her health that she had not mentioned during the initial consultation, which confirms the importance of that approach. She also said things she had never said about her diagnosis. She revealed the information I had no idea were there. I don't think we're going to go into details here, but I don't have the time. By not giving a tumor remedy right away, amazing things happened, including increased well-being and her decision-making powers, her ability to communicate, etc. You know, if this weren't just a teaser, I would go into all the details of this because it's fascinating, because it really tells you why people don't often tell you all their history that is relevant to the case, but they simply can't tell you because of pathology that's already there, and you have to deal with that if you recognize that. Anyway, so I will discuss this case someday in a separate seminar. The next case, please. Squamous cell carcinoma of the throat. Let's call him Bill. He was a contractor, general contractors, run from construction site to construction site, very busy man. In his late 50s or early 60s, I think. Well, 61, okay. He had shooting pains for the past 9 months in his throat on the left side. It started with a throat infection. At first, he thought it was just a common, an infection. Took antibiotics for it, then painkillers. After he realized he was still on painkillers after several weeks, he went back to the doctor, and they checked it out further. And that was a good thing, because they found out that now he had, in addition to his already existing prediabetes, he also now had squamous cell carcinoma of the throat, as confirmed by biopsy. The first thing he did, though, was try cannabinol, which is an oil derived from the cannabis plants. You know, see, we're on the right track. Cannabis is a homeopathic drug. It's in Oncology, Materia, Medica. But now, of course, it's getting all this attention. Everybody thinks it's going to solve all their problems. No, it's not for everything. It is for certain specific things, and it works, just like anything else. And it works even better in some cases in potency. While some precancerous lesions on his skin disappeared, his throat cancer would not budge. However, he got a few side effects from it, and other people have reported side effects such as a spacey feeling from cannabinol, such as not being able to concentrate, such as feeling woozy, dizzy, all kinds of things. Anyway, the doctors also found HPV markers in his case, prescribed antivirals, which he didn't take. Instead, he followed his veterinary doctor's advice and sought out Manfred Mueller. Bill had many amalgam fillings since his childhood, so that was brought up. I always ask, because why should you try to treat a case with all this burden, this toxic burden, right in their mouth? When you take care of it right at the beginning of treatment, and of course we go into detail how to do that in our tutorials. There were some issues from distress at work, certain disappointments that he suffered from, also some family issues. Although his wife was extremely cooperative, there's many issues in the church and so forth. This is often the case of when you're in a group of people who love you, they think that if you go the alternative route, there's something very wrong with you, and they try to convert you quickly, and they're so urgent about this. But he was resistant. Bill didn't reveal a lot of this initially because he was a closed person. He didn't, he had all this mercury in him. Of course he's going to be closed. He was also nutritionally deficient, which is, by the way, described by many 19th century homeopaths when they said, after mercury treatment, it caused a nutritional deficiency. And they recommended silica for that. Well, guess what? Bill got silica too. So he was on Natrium muriaticum to address some of the disappointments on an emotional level. He was on Lycopodium to address some of the work stress, or you could say his defense mechanism that kicked in. And he got Hepasulf to antidote mercury, an excellent antidote. Hahnemann used it in crude form, but it's horrible. You can't use it in crude form. It stinks of sulfur. And finally, silica for nutritional enhancement, Bill's tumor drug was interesting. It was based on a search I did. I was trying to find a single homeopathic remedy after the oncology material. This is after this was finished. I could not find a single one that listed squamous cell carcinoma of the throat. However, I've been working already on the second edition of this book. So I found one in there. The only one, Argentum nitricum. And of course, he had a cancer diathesis, and that was covered by carcinosin at first in the 30C potency, and then once all the clearing was done, clearing is the tardopathic treatment with pharmacodes, as explained earlier. And we went to a daily dose, all of these in Q potencies alternating. He also did the full protocol that we recommend of auxiliary therapies. That includes a dietary therapy. We reduce animal proteins. We add the juicing protocol. He couldn't do the full juicing, but he did about half of it. Well, maybe up to 8 cups of vegetable juice per day. The details are found on our website. Also, he decided to get rid of his cell phone. And that was important because it was difficult at first, as he depended on that phone for his work. But he thought his health was more important than his work. So he had an office. He received his call. He forwarded his call to his office line, a landline, and started answering his phone when he was there on the landline. And otherwise, he'd receive messages. Sometimes his wife answered the phone too when he was out on a job. All of these details are discussed in our tutorials. These are suggestions we make for the client because they often don't come up with this. Bill did well for the first several months, except he continued to lose weight. That's important. That tells you something's still wrong with this treatment. There's something amiss. And of course, we knew it wasn't going to cover everything, but the Argentum nitricum did not substantially reduce the size of the tumor or the pain of the tumor. He was continued bothered by pain and also by a deep-seated anxiety and fear of death. So 9 months into the treatment, I decided to switch to arsenicum, and lo and behold, it fit Bill better. He quickly regained his weight. He had less pain and also less anxiety. He would sleep through the night. He felt better than ever. And he said one day he confessed that he had not felt so good since his childhood. And by year's end, he, by the way, that was an acute potency, that arsenicum, just like the other medicines. And it was given in alternation, just like the Argentum nitricum had. We explain all this in the Mueller method. We give the Q potencies and ascending potencies, going up, 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 up. And then, of course, sometimes you have to stop, but that requires that you have access to all these potencies. In any case, I said he was better than ever. Oh, by year's end, that was last year, Bill was told by his veterinary doctor. It was funny. And he actually went to him to look at his cancer. This is the guy who had looked at it when it was first developed and who told him that, yes, that was cancer, and had urged him to get a biopsy. This man had also sent him to me. After examining his throat, he said he was completely free from cancer as far as he could tell. This was confirmed over the next 6 months by a total absence of pain. There was no further pain. He finally then had a second biopsy, and it confirmed it also. They couldn't find cancer. Bill has continued his organic diet and juicing, and he stays on several homeopathic medicine today. That's our brief teaser on homeopathic cancer treatment. And I'm planning to do a more thorough seminar with several parts to go more into detail specifically and also cover other cases. The details do need to be discussed more in detail, but you can't just, from the brief introduction here, go ahead and start treating. But in the meantime, you should read the Cancer Oncology Materia Medica. Like I said earlier, I'm still writing on an index and repertory for the Cancer Materia Medica as it was published last year, and it contains a description of the types of cancer in modern medical terms. Of course, some of them we don't know for sure, so we do the best we can. The repertory and index by location, just like Lilienthal did of all our Materia Medica. Then it includes the pathology, a description of the pathology, and also the drug description, what part of the location, what type of symptoms the drug covers. A tumor repertory, a constitutional repertory by causation, etiological repertory, and of course, a brief version of the indications listed for each drug, for each medicine. You will have a brief introductory indication section. Now I'm willing to I'd like to have you ask some questions. I know this was a tour de force, but that's the nature of the subject, isn't it?
It was indeed a tour de force. I know I have not left my screen the entire time. Thank you, Manfred. That was absolutely fascinating.
My
don't have a
pleasure.
lot of questions yet. Don't have a lot of questions. If people, we do have a few more minutes. We'll see if we can get in. Could you let people know how they could purchase your book?
No, it's listed everywhere. Go on Amazon.com or go on our website, whatever you prefer. The Dana Allman's outfit is listing it. Emrys in Europe is listing it, and all the associated and affiliated bookstores. It's available on Amazon in Italy and France and other parts of the world. So whatever you prefer. I do recommend you read the reviews. Francis Truhers did one review. And you can read that on Amazon.com because he decided to put it on Amazon. Then there was a review on H-pathy. I forget the name of the reviewer. And then there was Dr. Rosenzweig from New Zealand did a review. He published it in one of their journals. I think it's an Australian journal, actually. But it's well worth reading. So feel free to search for it. Okay.
We're getting the same question from a bunch of people, and that is, how do you deal with the allopathic treatment and the homeopathic? Would it be concurrent? Would you ask them to stop? What would you do?
Yeah, so unfortunately, I did not actually mention. I didn't go into the detail of that second case. There was surgery, and the treatment continued. She was out for a week. There were some remedies like arnica, but the same remedies were given. And there was, I think, one additional one. There was some need for an additional daily remedy. So that needs to be taken into consideration. And it's very different with the drugs, the chemotherapy drugs. And I'm going to have to do that in a separate tutorial or in a separate seminar because that is complex, much more complicated. We do have specific homeopathic remedies that we use, especially during the early part of the chemotherapy, that boost the organism, that help the body to receive all these toxic drugs. And it really depends on what drugs, too. You will find some of them were found by Grimmer. He had cadmiums. The cadmiums were something that he used. And giving those in daily doses takes a lot of the aggravations away that Grimmer still saw in some of his patients. I stay away from the very high potencies in centesimal form. I use the very mild Q potencies, and they do a great job when it comes to countering the effects of chemotherapy, but we also clear them with a reverse chronological tautopathy methods, just like we do with all medical drugs during any homeopathic treatment. We use the 30C for that. And that's all based on observation and experience.
Wonderful. We have time for one more question, and that has to do with how your methodology, the Mueller method, and the Banerjee protocols, is there overlap or are there differences?
Well, I have incorporated and I use all the drugs too on different indications. Of course, with the Banerjee protocol, they've come up with some specific drugs, and they even did studies on some of them. One study was done by, I think, Patak, Yes, I think so. And there was on a glioma, a number of glioma cases that were treated with ruta. I think low C potency of ruta and daily doses of calcarea phosphorica in an X potency. I think it was a 6X. I don't really use that much. I use the Mueller method. That means the incorporation of all of the methods we have. But yes, the medicine suggested by the Banerjees have come in handy sometimes.
Okay, I lied to you. I said last question, but this is a good one. You are mentioning a lot of obscure remedies, and people want to know, where are you sourcing them from?
All the remedies come from all of our Materia Medicas. I chose, I think, a total of 300. Definitely 300 Materia Medicas. The others were other books. Some of them are just cancer books by various authors, but they're listed in the Encyclopedia Homeopathica. 200 were the Materia Medicas, and whenever they mentioned a remedy for cancer or any kind of cancer, and if I felt there was sufficient information to incorporate it into the schema of the that I had decided on, of what was needed to know, what we needed to know about the drug, I incorporated it. The one I think Dr. Rosenzweig pointed out in his review, and he, by the way, said this was a perfect job, but he did say one thing. He said, how come, he asked me in person, how come he didn't incorporate all 900 remedies that were listed in I think they're in reference works under cancerous affection? Well, the reason is because many of those remedies came out of nature. Robin Murphy's Nature. They're basically just herbal medicines that he had listed for cancerous affections. None of them were classical homeopathic remedies. All our remedies listed in this one are classical remedies that had at one point or another been looked at by a homeopath and incorporated into our Materia Medica, although many have not been proven.
And I think the question also is, where are you actually sourcing them? Where are you getting them? Are you making them, or can you buy them? Do you have a place to recommend for the more obscure
Yeah.
ones?
Oh, I'm sorry. I didn't realize that was the question. All right.
No worries. No worries.
We in our practice have perhaps the largest pharmacy, in-house pharmacy in North America of any homeopath, because we've got thousands and thousands of medicines in hundreds of different potencies. So where do we get them from? Well, we buy them wherever we can find them. That includes, and I want to mention, Dr. Robert Mello's outfit, Ohm Pharmacy in Texas. Of course, Hahnemann Labs in California, Helios in England, and Ainsworth in England. Those are our main sources. And altogether, when we can find one, we have it made.
Fantastic. I think we're out of time. You've been very generous. So we all want to thank you so much. We're getting all sorts of accolades. Thank you for writing the book. Thank you for coming and talking to us.
My pleasure, and thank you.
All right, everybody. Good night, and we hope to see you at another webinar soon. Take care.
Good night.